Good day, everybody. Welcome to the Bob Unger Show. We have a very special guest. You know what they say, Diogenes was found walking around with a candle, and people kept saying, "Why are you walking around with a candle?" And he said, "I'm looking for an honest man." Well, Dr. Soloway, Stephen Soloway, fits that description. He's a guy who's a straight shooter. He speaks his mind. And I respect people like that, even when I don't agree with them, as long as it's coming from a place of integrity. Robert F. Kennedy Jr., who I met, was a lifelong Democrat. And I'm not a Democrat or a Republican, but I'm certainly not a Democrat. And I have immense respect for him because we might not agree on everything, but both of us care about the truth and both of us stand up. And that's what Dr. Soloway represents. And he ought to know because he comes from the belly of the beast. He's a medical doctor. And he writes about the, to put it mildly, incestuous relationship between politics, medicine, the drug companies, what I call the medical industrial complex, as Eisenhower called the military industrial complex, which we have also in this country. And so, Doc, give us a little bit of your background, and then we'll start getting into your book, Bad Medicine, and your other book, Medical Politics. And tell us about yourself.
Bob, thanks for having me on the show and giving me this opportunity. So I'm born and raised in New York City. I grew up in a lousy area, Left Rack City, Corona, Queens. I went to medical school at American University of the Caribbean in Montserrat. I completed a rheumatology fellowship at the Philadelphia VA and the Medical College of Pennsylvania. And I've been here in private practice for 30 years. I have become synonymous with arthritis and rheumatology in South Jersey as the thought leader and the patent holder for various needles and treating immense amounts of patients, so much so where I feel criminalized and always investigated for the past 15 years for seeing more patients than the average person, because I'm not the average person. I work harder. I'm here 12 to 16 hours a day with compassionate visits with patients who are coming here with arthritic problems and pain. And when I first started in medicine, I really enjoyed it very much. That includes 2 years in London, actually, as a medical student, rounding with doctors, meaning we'd stand at the bedside. We would talk about the disease, the process. We would talk about the physical findings. These are things that no longer happen, at least not in the United States. Now, everything in the United States in medicine is about documentation. The nurses can't come visit you in the room because they're on the computer documenting that they think you're breathing. The doctor doesn't come in the room because he's a shift worker and he's no longer your family doctor. He's somebody that was hired to cover the babysitting duties at night at the hospital. So if you get sick when you're a patient at night, back in the day when I was coming up through those ranks, I was being a proxy for the senior doctor, and I'd go and spend as much time as necessary with sick people, performing everything within my knowledge field and testing abilities to get things done and report back to that doctor who was the actual doctor for this patient. And now you go in the hospital, there's no time for you. The test that should be done isn't thought about because it's either too expensive or because nobody does it at that hospital. And strategically, they pick procedures that you can't have as an inpatient and so on and so forth. So the ability used to be, well, there's two sides of medicines. There's the political side, there's the medical knowledge, and then there's the business side. The business side of medicine used to be that any entrepreneur would go into medicine and they'd start a practice and they'd work as many or as few hours as they wanted. And they'd have a nurse, they'd have a staff, they'd document their notes either by pencil or pen or pick up the telephone and dictate to a typist. That's been taken away from us. The government, starting with Obama, instituted the mandatory implementation of computers, which is really just another way that you can be audited while you're sleeping, and they invade your privacy. Now, it's funny, it's so hypocritical. This ridiculous HIPAA Act has made it so that doctors won't speak to anybody about patients, which causes a problem in patient care in many cases. And in fact, Obama himself said that one of his greatest tragedies and failures was implementation of HIPAA. Well, that's the one he admits to, or whatever, but there's many other failures, such as the use of computers, which make it very difficult for people that have been practicing with the pen and paper for 20 years to switch. No different than the Chinese communists who changed the language at World War II so the peasants could be kept in the dark. Well, the peasants now are all the doctors, and the government is they're funneling your freedom of speech through Twitter or through Facebook or whatever. And they're also funneling your healthcare through the giving of money to a health system to purchase your practice, put you on salary, shut your mouth, tell you what to do, and you just have to document. So the doctor has been belittled now to a secretary for the most part, or a shift worker. And the next step was going to be, we'll be a kiosk and they won't have us anymore. And the only people that will be in medical school will probably be working for a government to come up with bioterrorism to combat the bioterrorism that we started already, which has been re-released and attacked us.
Yeah. When you talk about medical politics, I assume you're talking about the intersection of the political, the financial, and all these areas. Talk about what they promote. And you've been out for a long time. What they're promoting in medical schools today, to your knowledge, in terms of
Oh, yes, yes. I'll
being
answer
in
this right
bed with
away.
the drug companies.
Well, to answer your question, I'm going to start by telling you what they're promoting in medical school today is that, contrary to 30, 35, 40 years ago, they're not promoting people to go on through internal medicine and do a subspecialty such as cardiology, pulmonary, rheumatology. They're promoting people to stay within the hospital they're trained and be professional babysitters for the rest of their life. And by doing that, they have control over you. And by having control over you, you get a low salary, but you don't get audited. They no longer promote accelerated or higher levels of education within the internal medicine boundaries. What I mean by that is, to be a cardiologist, or what I am, a rheumatologist, you have to do 3 years of internal medicine residency, and then you are deemed board eligible in the subspecialty, which would be the rheumatology, the kidneys, the endocrine, the hormones, or the pulmonary, the cardiology, etc. So that's a subspecialty of medicine. They're encouraging people not to do this. They're encouraging people to stay back at the health system. They are misleading the trainees to think that they'll make more money by being part of a system because the system can negotiate on their behalf, taking away their freedom. Nothing is free, of course, especially not your freedom. But if you give up your freedom, which they're encouraging the new trainees to do, this is a very bad situation, because we now do have, because of this socialized medicine, people aren't aware. Even Medicare recipients, when you get your Aetna HMO, I'm sorry, your Aetna value, what's it called? Yeah, Medicare value plan or something, where your Part B is covered by Aetna, Blue Cross, Cigna, Horizon, whoever, you're now under an HMO. So your doctor doesn't want to see you because Medicare doesn't pay him, and the other insurance, the carrier, whether again Aetna, Cigna, whoever, they make the rules. So if you want to order an MRI because your knee is swollen, it'll be denied. But if you had Medicare and AARP, it will be allowed. It'll be allowed, and the doctor will get paid half. And if you have with a private insurance, you'll get paid more, but they don't allow you to do anything. So in reality, you're not getting paid more. You're being given the illusion, as George Carlin would say, that you're being allowed to be paid more. You have the illusion of freedom. You don't have any freedom. In fact, you are owned. And, being an entrepreneurial doctor, a capitalist, you do have freedom. However, if you get too free and you make too much money and you see too many patients, even if you provide good care, if you're caught jaywalking, you'll be thrown in a Russian prison. Something will happen to you, even though you did nothing. And there has been a transformation from the 50s, 60s, 70s, 80s to the 90s up to 2020, where we are living in a socialist country. If you don't believe me, I know you believe me, but if the listeners don't believe me, it's because maybe they're being complacent and maybe they don't want to get ahead and maybe they're not interested in the politics that affect them the most. And we need to protect our liberties and we need to protect our medical system, because honestly, I've never met a patient who was happier to see me in the hospital because they told me, Doc, you're one of the few doctors that still comes to the hospital to see me. And the other people, they run in and out. They don't tell me anything. I'm scared. My family sometimes wasn't allowed in because of COVID. I have nobody advocating for me. You're advocating for me. I love you. Thank you so much. Whether I get better or not, at least I know somebody's on my side trying to help me. That doesn't exist anymore. This is a dying breed.
My friend Dr.
My
Katz,
job security is that I'm a dying breed.
my friend Dr. Katz, who's a very smart guy, he's a Yale graduate. He's a 42-year medical doctor and a lawyer, although he never practiced. He was kicked out of his hospital, not allowed to practice there anymore because he dared to even question the vax, questioned it. And that got out, and boom, he can only work in a satellite office. That's what's happening.
You've just summarized my soliloquy. You're not allowed to talk or think.
Yeah,
Keep everyone stupid.
and they've
Not
done
allowed
a
to have a
hell of a
thought.
job, done a great job. People like yourself are curmudgeons and anachronisms, unfortunately.
No, 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 no. We're not curmudgeons. We are still productive.
Yeah,
The curmudgeons are the ones that are sitting at the desk in the hospital at my age, staring at the walls and watching the paint dry.
good point. That's a great point.
In fact, we don't have curmudgeons anymore. We have doutards.
So you have a website called badmedicinebook.net. So anybody interested in getting the works of Dr. Soloway, go to badmedicinebook.net. I want to make sure we get that out before.
And I would be honored to personalize the books to anybody that is interested in my autograph.
Okay. That is a great offer. And people don't realize, because unfortunately, the average person doesn't question anything that a doctor tells them. He tells them to take a medication, and they don't even bother to do a little research and say, wait a minute, what is the effect of this medication? Because most of the time we wind up in vicious cycles. You take one medicine, which causes another problem, which then that causes another problem, for which they give you another medication, which then causes another problem. They misdiagnosed my 2-year-old as being epileptic and recommended Tegretol for a 2-year-old. And it turned out that this doctor was an influencer for the drug company that manufactures Tegretol. Maybe you can speak on that.
No way. I don't believe you. I don't believe you.
Now don't, that's unethical.
I would tell you that 99% of doctors did not go to medical school and waste all their time in training to come out as a crook or a criminal or a deadbeat or a curmudgeon or a dotard or any of these things. But there is a percentage of doctors who feel entitled that the day you graduate medical school, somebody's supposed to hand you a check for millions of dollars. That's not reality, but there are a small percent that believe it. So what they do is, yeah, they cozy up with these pharmaceutical companies. They cozy up with whatever agency is pushing some agenda or TV commercial. And yes, they supplement their income by doing unethical things. It is disgusting. It is ridiculous. And frankly, you know, caveat emptor. I mean, the buyer needs to be aware, why are you going to this doctor? How did you get to that doctor? Who referred you to that doctor? Is it the friend of somebody? Is it within the same network? You need to have an independently self-employed doctor who refers you to the best. Maybe it'll be at System A, System B, System C, or maybe it'll be another person in private practice. But you want to make sure that you're getting the best care possible by a free thinker, not somebody who can be influenced by a system or a thought process. You need a doctor who thinks outside the box and thinks for himself or herself. This is a big
Well,
problem we have today.
Bernie Madoff had a lot of very smart clients who checked him out. They did do the right thing. The problem is that the government also checked him out and told them that he's great. And so they had a government agency telling them that he's great. And it's the same thing with the government agencies having to do with medicine. People think if the FDA approves something or the CDC concurs on something or the Surgeon General or Joe Biden, that genius of a doctor.
Now that's a curmudgeon. That's a dotard, okay? There's your real dotard.
Well, you know what I want to do? I want to get Dr. Katz, and I want to do a conversation with you, me, and him.
Love it.
Sometime next week.
Love it.
Because he's got a lot more knowledge than I do in the medical area, and I think he could add a lot. And you two, I think, would also get along really great.
But I love it.
We only have 1 minute according to Zoom, and I want to re-emphasize that this is a great guy. This is a doctor that you should be proud to go to, because you can tell from the way he speaks that he's going to tell you the truth, and that's what you want when you go to a professional. Just tell me the truth. Explain it to me. Care enough. I believe that if you really care about somebody, you tell them the truth, even if it's not pleasant. You tell them the truth because you care,